Neurogenic shock is kind of unique and interesting when you think about the different types of shock. Neurogenic shock, you'll learn more about when you talk about spinal cord injuries later in the curriculum, but it is usually caused by a spinal cord injury. So there is usually a high level spinal cord injury, and that causes vasodilation, and you'll learn more about that later. Be aware that there's also something called spinal shock, and then there's something called neurogenic shock, and here we're talking about neurogenic shock. But basically, because of that damage in that area, it causes this vasodilation and really cardiovascular collapse, and that is a really, really problematic scenario. So if you think of someone maybe who's fallen from a ladder or from their roof, maybe they land incorrectly, and then they have the issue of paralysis or temporary paralysis, and then this risk as well. What's interesting here is you have a decreased blood pressure and a decreased heart rate because of overall collapse because of the innervation of the spinal cord. So this is very unique in that there's drop of both blood pressure and heart rate. They can also have some respiratory and oxygenation changes because of the level of injury. With high spinal cord injuries, there's a risk of them being unable to breathe. That's where things tell your body where, to do its breathing. So that can be problematic. And you might see temperature changes as well, maybe an inability to regulate that temperature. So the treatment with this is to stabilize that patient's spine and to treat that, which you'll learn later in the curriculum. And then really to treat hypotension and bradycardia. That will probably be where you're going to focus your efforts in critical care class, to treat hypotension and bradycardia. So think about medications that would increase one's blood pressure, and think of medications that would increase one's heart rate. And I'm going to let you tell me what you think some of those medications are. Okay, so medications that are used to increase blood pressure. There's a few different ones. We can think of epinephrine, dopamine, or dobutamine, or norepinephrine. Those all increase blood pressure. And then bradycardia, I always like to remember atropine. Atropine is used to treat symptomatic bradycardia, right? That one will not help with blood pressure, but that one could be really helpful in this particular situation. Other things that increase heart rate are epinephrine and dopamine. So those can be assistive to this patient. So that's really all we're going to cover in neurogenic shock in this class. And we will move on to our next condition.